Dry eye is one of the most common problems that we see. The patients present with itching, burning, red, irritated eyes. They're uncomfortable. They're unhappy. They want a treatment that works.
Approximately 7.5 million people suffer from moderate to severe dry eye in the United States, with an estimated 2 to 3 times that number suffering from milder forms of the disease. And approximately 5 million people are unable to wear contact lenses because of dry eye. In all, according to many published studies, dry eye sufferers are categorized as some of the most medically miserable people on the planet. So much so that it is not uncommon for dry eye sufferers to frequently change eye care doctors in pursuit of some form of relief. Dry eye syndrome, clinically known as keratoconjunctivitis sicca, describes the changes in the eye resulting from either a lack of tear production or an excessive tear evaporation, and covers a range of tear film to ocular surface abnormalities, including burning, stinging, itching, tearing, blurring of vision, dryness, soreness, foreign body sensation, and photophobia. Along with these symptoms, the potential for ocular infection and damage to the cornea are also present. Yet for these patients afflicted with these annoying symptoms, doctors often attempt to treat this condition with a myriad of high-priced lubricating eye drops, ointments, and medications to be used many times during the day, often yielding minimal or no relief. There is, however, an alternative treatment option that doctors and their staffs can now offer their patients. This option is the long-term occlusion of the puncta, utilizing the Smartplug from Medennium. The Smartplug is a flexible thermodynamic acrylic punctum plug designed to fit and stay in the punctum, ultimately allowing for an increase in tear film retention, while providing maximum patient comfort. Use of the Smartplug will potentially decrease and even eliminate the signs and symptoms associated with dry eye, ultimately restoring comfortable vision to dry eye sufferers around the world. Compared to rigid silicone punctum plugs with complex shapes and protruding caps and anchors, the Smartplug's smooth, simple design and distinctive thermal expanding material properties are designed to enhance ease of insertion and decrease or even eliminate the potential for patient discomfort and foreign body sensation. And because the Smartplug is made of a flexible thermodynamic acrylic, which is rigid at room temperature and flexible at body temperature, its properties are designed to allow it to be easily inserted through an undilated punctum, and then accommodate to the natural size of the punctum, thereby eliminating both the need to perform time-consuming and cumbersome punctal size measurements and dilations, while eliminating the need for different size plugs. The insertion procedure is extremely easy for both you and your patients and only takes minutes. Discussing the patient's ocular symptoms and obtaining a complete medical history will help in making a correct diagnosis. As you know, it's important to remember that dry eye is found in both men and women of any age. Dry eye affects people who wear contact lenses, people who have had a variety of external eye diseases, people who are taking medications, pregnant women, postmenopausal women, people who have Sjögren's syndrome, people who are exposed to a variety of environmental conditions, and people who have had PRK or LASIK. If the patient fits into any of these categories and complains of any of a number of ocular symptoms including burning, stinging, itching, tearing, blurring of vision, dryness, soreness, foreign body sensation, photophobia, or general discomfort, then they may have dry eye syndrome and be a candidate for the Smartplug. A complete examination including tear-related diagnostic tests such as fluorescein staining, Rose-Bengal staining, or the Schirmer basal tear secretion test with topical anesthesia will help you confirm your diagnosis. With a positive diagnosis of dry eye, the Medennium Smartplug can be inserted. The Smartplug is provided as a long, thin 10mm length, thermally expanding acrylic rod designed to facilitate handling and visibility during insertion. Its small diameter is designed to allow it to be easily inserted without dilation of the punctum.
What's great about the Smartplug is it's easy to insert and it's well tolerated. It's a flexible material that expands to fill the punctum and occlude the drainage system. There's no cap to rub against the eye and cause irritation. One size fits all your patients. You don't have to worry about sizing the punctum for the right size. The plug is designed to go into the punctum and stay there, and it does.
Before beginning the insertion process, anesthetize the area of the puncta with a topical anesthetic. The Medennium Smartplug comes in an innovative disposable carrier. To begin, open the Smartplug carrier in the prescribed manner, and utilizing the single-groove Medennium Smartplug forceps, model 502, remove the Smartplug. Once this is done, view the punctal opening. Keeping the plug from contacting body temperature before it is inserted is important, as this will help avoid pre-expansion of the plug tip and allow for a more efficient punctal placement. Next, place the plug into the punctal opening and advance it 2/3 of its length into the punctum. As the smart plug is advanced into the punctum, it begins to contract and expand. You'll notice that the 1/3 portion remaining outside of the punctum will gradually retract into the punctal opening. The smart plug was developed to soften and accommodate the punctal opening when it comes in contact with the body's thermal energy, ultimately allowing it to accommodate to the natural size of the punctum, providing complete occlusion. The retraction should be observed. If after 30 seconds there is a portion of the smart plug above the punctal opening, forceps may be utilized to push the plug below the punctum. If necessary, the smart plug is designed to be removed by irrigating it out. The smart plug, a flexible thermodynamic acrylic punctum plug designed to fit and stay in place, ultimately allowing for an increase in tear film retention while providing maximum patient comfort. Its smooth, simple design and distinctive thermal expanding material properties are designed to enhance the ease of insertion and decrease or even eliminate the potential for patient discomfort and foreign body sensation. The smart plug's flexible thermodynamic acrylic material is designed to allow it to be easily inserted through an undilated punctum and accommodate to the natural size of the punctum, thereby eliminating both the need to perform time-consuming and cumbersome punctal size measurements and dilations, while eliminating the need for different-sized plugs. The Smart Plug, from Medennium, designed to be a simple, safe, and effective device for punctal occlusion and the treatment of dry eye.
What we're really talking about is a successful treatment for dry eye and making our patients happy, and a product that will do that. We believe the Smart Plug is the answer.
The Smart Plug, from Medennium, providing ophthalmic patients with a new way of seeing.